Welcome to the 7th segment of our series of Sound Mind, which examines healthy cognitive aging and the dementias, sponsored by the Stanford Alzheimer's Disease Research Center. In this episode, we're going to focus on biological specimens such as blood, cerebrospinal fluid, and how they relate to our understanding of the brain. We're very fortunate tonight to be joined by two very special guests whom I'll introduce in a moment. I'm Dolores Gallagher Thompson, and I'm the host of this series. I'm a research professor in the Department of Psychiatry at Stanford. And I'd like to introduce first Dr. Edward Plowey. Dr. Plowey received his MD and PhD degrees from the University of Illinois at Champaign-Urbana. Then he completed his residency in pathology and a fellowship in neuropathology at the University of Pittsburgh. He is an assistant professor of pathology at Stanford and is an NIH-funded researcher to study Alzheimer's disease. Ms. Ileana Garcia Ruiz has received her bachelor's degree in Latino Studies from the University of California at Santa Cruz. She is the Latino Outreach Specialist of the Alzheimer's Disease Research Center at Stanford, and she is also Program Coordinator at Nuestra Casa, which is a community-based health education organization in East Palo Alto. She coordinates there the Promotores program, which sends lay health educators into the community to help them understand health issues and reduce some of the health disparities. So let's start with the science first, Dr. Plowey. It's my understanding that biospecimens are necessary for a better appreciation of what is happening in the brain. Can you help us understand a little bit about that, please?
Thank you for having me, Dolores.
Okay.
Alzheimer's disease, Parkinson's disease are very complex diseases of the brain. Our research and understanding is critical for our continued understanding of these diseases and getting us closer to a cure for these diseases one day. We would love to be able to take biopsies of of a patient with dementia to learn more about the process while they're living, but this isn't possible. So we need to rely. It's not possible yet. We rely on biospecimens, which are other tissues which interact with the brain. They include things like cerebrospinal fluid, blood, and more remote tissues like the skin or even the stool.
So what do you learn from something like, say, cerebrospinal fluid? I'm afraid I don't know what that means. So can you help us understand what that refers to, and what do you learn from it?
Well, from these tissues we get biomarkers, which are data that indicate what's going on in the brain. The cerebrospinal fluid is the fluid that bathes the brain, and we look at different chemicals and proteins that accumulate and tell us about proteins that are maybe abnormally aggregating or accumulating in the brain and indicative of certain diseases.
So it's a marker of what's happening in the brain,
Absolutely.
cerebrospinal fluid. And that's something you can get from a person while they're alive?
Yes, our clinicians can do what's called a lumbar puncture to obtain cerebrospinal fluid while a patient's alive.
Okay. And then you mentioned some other things. You said maybe skin and blood.
Blood gives us a lot of information. From the blood, we collect white blood cells, which are our immune cells, the cells that fight off infections. And they tell us about how our immune systems play a role in these diseases. We also isolate DNA, which can tell us about genes that may increase the risk that a patient has for having one of these diseases. We also collect plasma, which can give us additional biomarkers. You mentioned skin. We collect skin as one of the most exciting areas in neurodegeneration research today. In the past, we were never able to study human neurons, but now researchers, including investigators at Stanford, have developed ways to turn our skin fibroblasts into neurons for us to study and model diseases and learn new clues about how these diseases occur and how to treat them.
You can actually create neurons?
Yes.
At this point? Isn't that's amazing?
This is a rapidly developing field, exciting field.
Yeah. And how does that tie in then to understanding Alzheimer's disease and other neurodegenerative disorders?
Well, it gives us additional ways to look at cells that are native, that are basically a model of the cells in the human brain, which we can't otherwise study except potentially in animals. But those models are not the human disease. So these get us closer to the human disease.
This is fascinating. It really is. But I would like you now, though, to talk more about the brain itself. Okay, if you could help us understand, what you as a neuropathologist do with the brain.
Well, a neuropathologist is a physician who specializes in the diagnosis and causes of brain disease. We are part of a team, and our role in the team is to look at brain tissues under a microscope. And our specialty is to gain clues from the microscope to diagnose and better understand diseases.
Okay, so you study brains under a microscope. What else do you do with the brain?
Well, typically when we get a brain donation from one of our patients with dementia, I actually can hold the brain in my hand and look for pathologies that I can see with the naked eye. So for instance, there may be areas where the brain is atrophied or smaller than normal, or there may be, for instance, an old stroke that can account for the disease. But actually most of the pathologies that account for dementia can't be seen by the naked eye. And to detect those, we create really thin sections of the brain, put them on a microscope slide, and I look at them using different types of microscopes. We actually have a couple of pictures of what I might see under a microscope. So for instance, a patient may have been diagnosed with Lewy body disease during their lifetime, in which case I can see Lewy bodies in the neurons of the cortex. And they are these very pink inclusions in the neurons themselves. And we can use what's known as an immunostain to detect the abnormal protein in that inclusion, which is called alpha-synuclein. The next figure actually shows the plaques and tangles of Alzheimer's disease, another commonly diagnosed disease in the patients that we study.
Yeah, so I've read about the fact that plaques and tangles can occur at virtually any age, and they don't necessarily mean that you have Alzheimer's disease. Is that a correct understanding?
That's absolutely correct understanding. Alzheimer's disease pathology, the abnormal pathologies that occur in the brain are very common as we age. And actually, it's very exciting. We're learning that these pathologies happen at very young ages, even some of us in our teens, 20s, and 30s, which is very exciting because if we know more about that, it may open up new avenues to prevent these diseases.
Yeah, so it's possible to have some plaques and tangles and not have Alzheimer's disease.
You can have plaques and tangles, but certainly not have the cognitive impairment that we associate with Alzheimer's disease.
Great. Well, that's very important information, I think, because a number of people get tested, they get MRIs and things like that, and so they hear about this, they learn that maybe they have these things, and they worry that, oh, that means I'm going to definitely get Alzheimer's. But you're saying that it's not a one-to-one relationship.
There are many factors, our genes, the environment that go into how these diseases manifest in different individuals, and we're learning more about these all the time.
Well, I think at this point our audience would be very interested to know about the brain donation process. You know, from what you've said, it sounds like it's really important to have these brains after the person has passed on to be able to study and really to inform our research and to help future generations. So what is the process of brain donation?
Well, we really encouraged our enrolled participants from whom we study in life to donate their brains when they die. We call neuropathology the gold standard of diagnosis because it really gives us the final diagnosis in looking at the brain itself. The brain donation is a gift for which we are tremendously thankful. It gives tissues to our fellow scientists to better understand diseases. The three parts of the brain donation process, including giving consent, then devising an autopsy plan, and then the rapid autopsy itself.
So there are three parts to it. So yes, that's very interesting. And you said it starts with giving consent. So does the person themselves, while they're alive, are they the ones who give consent?
Well, typically, when the enrollee is alive, it's something they'll discuss with their next of kin. And again, it's something we are very much encourage and appreciate. But actually, when a patient dies, they're not able to consent to their brain donation. And it must be what we call the next of kin, either a spouse, sometimes a surviving child, and sometimes it's the person that has been designated to take care of the patient's estate.
Like a legal representative, yeah. Okay, so let's assume that goes well and you have the consent. So what happens next? You said the second step was the autopsy plan. So how does that work?
So the autopsy plan is something that's formulated by myself and people that assist me in the autopsy. But the next of kin plays a critical role in informing us when a potential brain donor has passed away. And oftentimes a hospice nurse also plays an important role in informing us when our patient has died so that we can then set the wheels in motion to actually do the autopsy, transport the patient to Stanford, and perform the autopsy.
Yeah, I mean, that makes a lot of sense that the next of kin would need to be the people who inform you that the death has actually occurred, so you can start the ball rolling, like you said. So then the body is transported to Stanford, and what happens at that point? What actually is this rapid autopsy that you mentioned, step three?
So we actually very carefully remove the brain. This occurs through an incision that's in the back of the scalp, and we then preserve the brain for both arriving at a diagnosis, as we talked about before, as well as preserving tissues for future research.
So is the face disfigured in any way when you do this to the back of the skull?
Absolutely not. It's an incision in the back of the scalp, and this is not visible, for instance, if the family would like to have an open casket viewing for a funeral.
I think that's important for our audience to know, because I think many people are reluctant, thinking that there will be disfigurement and they will not be able to have the rituals that would comfort them and comfort the family in their grieving. So it's good to know that that's not the case. Absolutely. Yeah. And my final question to you has to do with what can the family learn from this? You know, this is a very stressful experience for them, I'm sure. And so what is it that they can hope to learn from you?
Well, typically my diagnostic workup does take some time. We perform a lot of complex studies that usually take about 2 to 3 months. So we ask for the family's patience. But when I do arrive at the diagnosis, I issue a report, and this report can be obtained by the family from Stanford Medical Records. It's very technical, and so oftentimes the patient's neurologist is available to speak about the diagnostic findings in lay terms.
Yes. I imagine that would be very helpful, because I'm sure there's a lot that most of us would not understand, not being medical doctors.
I think that most of the families really appreciate understanding the disease that basically inflicted their loved ones during life.
Yeah. And it sounds like when you have these specimens preserved, that they can be used by other researchers. Is that a point that you were making
Yes, so we preserve the entire brain for future research, and so
The
when
entire brain.
the entire brain, and so when in the future a scientist at Stanford or even outside Stanford has an idea or a hypothesis about Alzheimer's disease and would like to test it, looking at human Alzheimer's disease tissues themselves, we can provide that tissue with a confirmation that the disease was Alzheimer's disease. And so our specimens benefit a lot of research, and that's something that we're gratefully indebted for.
So it sounds like there's a network of researchers.
There's actually a very high demand for these tissues to promote the scientific findings.
So in a way, the person continues to live on through this gift that they have made, through this donation.
I think that's definitely happens.
Okay, well, thank you. This was very informative. I know I learned a lot about biospecimens and research and what you collect and why you collect it and how you collect it. So I'd like to turn our attention now to Ileana Garcia Ruiz.
Thank you.
And Ileana, I know that for the past year you've been part of a research team at the Stanford Alzheimer's Disease Center that's been looking at brain donation in the Latino community. And I know that when you first started with us, brain donation was not something you knew much about. So could you tell us a little bit about how you began with us and what you've learned over the past year?
Yeah, I'm very grateful for the opportunity to be part of such a dynamic team, and to be able to represent my community. I actually didn't know anything about brain donation or at all even dementia or what Alzheimer's was, and I don't think even the community, the Latino community, knows as to what entails and what goes into. We just discussed what Ed was talking about, and I have a clue now because I work at the center, but my community needs to know about this, and I had no idea before working there.
So why do you think it's important for the Latino community to know about this? How is it relevant, or why is it meaningful to your community?
It's been a process in terms of, even me understanding and how I think my community might be able to understand. And it's really important and meaningful because, my community is actually more prone to a lot of diseases throughout the lifetime. And so that might be causing, this, the more prone to actual dementia. So it's really important for us to elevate, and start having a community conversation as to, what dementia is, and then talking about brain donation and research and participating.
Yeah, well, some figures that I'm aware of indicate that on the national level, when we look at how many Latino individuals have actually donated their brains for this type of investigation that we've heard about, it's under 10% nationally, and that's a gross underrepresentation of the number of Latinos in this country, and older Latinos, because people are living longer. So we want to correct that. So our center is particularly focused on drawing in Latino families. So what do you think might be some good ways to involve the community?
So we've actually, at the center, at the ADRC and our team, we've began collaborating with my other organization, Nuestra Casa, and it's a community education organization, and we've created material based on conversations we've had with a group of promotoras, outreach workers that work in the community. And so to me, this is really important in the sense that you can't bring education to a community necessarily. You have to, ask the questions first. What do they already know, and begin from there, because sometimes we're so used to bringing, materials and here you go, and instead of, communicating with the community itself, it has really helped. And one of the things that I really think is important is that it's a phrase. It's in Spanish. It's called "Hay cambios cuando hay conocimiento," and what that means in English, it's there's changes when there's knowledge. So if the community knows about about this disease and it begins by that, we'll have more Latino participants because they'll understand the importance of this disease.
Yeah, and you mentioned that there were materials, and
Right.
as I understand it, there was a collaboration between Ed and yourself and other members of the Stanford team to create these materials. And I think that's an unusual situation as well. You know, I think oftentimes the health educators are kind of in one, you know, they're all going on their own path and the scientists on their path, and it's not that easy to bring the two
Right.
halves together and to create something new. So in these materials, how would you say the process was of creating the materials? Would either of you like to comment on the process?
Well, I think we worked together to bring the process to just to bring clarity to it. 25 years ago, I had no idea what brain donation was and its significance either. So if you're not, if there's not a way that you can find out about it, then you're not going to be informed about it. But we worked together to make the different steps of brain donation and their significance clear.
Right. And I just to add to Ed, I actually he brought the clarity of the exact steps as to what happens. But I think our team and our knowledge base and me working in a community organization, we added that piece of cultural sensitivity and knowing and it's going to the ears and eyes of our community and are they going to accept it? And so one of a part of the process was after Ed gave us the list of of what happens for the steps of brain donation, we introduced it to the promotoras and they gave us the ideas of what things we can change. Also, with the team of Nuestra Casa, and so just that really bridging those two, the science and the actual community organization, and there's a lot of importance as to having a community partner for that reason. So bridging those two and creating that material for the community can really draw a lot of more people in, a lot of the, our communities of color.
Yeah, I couldn't agree more. So it sounds like there are some materials now. And what do these materials consist of? Could you tell us a little bit more about that, either of you?
Well, some of the materials, I'll add to it. So some of the materials is a brochure. And the brochure came about because, we wanted to put the steps on the brochure as to inform the families. But we also found that, our Latino community, based on the conversation with the promotoras, they see it as a gift, to future generations.
Yes.
So, all our lives in the Latino community were like giving and very, giving to our kids, to families, and we think that after death, that's it, but even after death, you can leave behind your brain, and it could serve to your future generations, possibly finding a cure or finding different ways of, educating the community and more ways to live a healthier life.
Yeah, yeah. Would you like to add anything?
Yeah,
to
I'd just
that?
like to add to that even with the brochure, if it piques someone's interest to try to become enrolled in our studies, that they can easily contact us through the Alzheimer's Disease Research Center website, and we would be happy to explain anything more that needs to be explained.
Yeah, because I would think that people might have more questions, and they don't know who to ask. I mean, there aren't too many people who are specialists in brain donation that you run into in your everyday life. So I think it's great that you're welcoming of questions and willing to talk with the community. So in terms of the future, we have a couple of minutes before we need to close the segment, and so I'd like to give you an opportunity to talk about where you see this going in the future. And I'll start with you, Ed. Where do you see this whole progression? Where are we headed with this?
Well, this is a really exciting time, especially for Alzheimer's disease research. Our government is allocating more resources to support our research.
Yes.
It's very much needed. In fact, even more is needed than what's being given, but it really helps to reinforce, to meet our goals, to help to try to prevent and or treat this disease, which is a goal for the next 7 to 10 years, actually. So we are building a strong center for our Alzheimer's disease research. We bring at Stanford University really world-class investigators from different areas of science to put their heads together to tackle very complex diseases. And I think support of our center, especially through this precious gift of brain donation, will really carry us to our goal of preventing and treating these diseases.
Yes, I think the Alzheimer's Association says that they are hoping that by 2025, yeah, there will be a cure and or treatment for those who are living with the disease now. So, but it seems like there's a lot to do between now and then. So we need many brains.
There's absolutely a lot
Yeah,
of work.
yeah. And Ileana, what do you see for the future? Where would you like to see this go in the Latino community?
I mean, hopefully in the future, I want to see my community participate in research primarily, and then also hopefully get a good brain bank going of Latino brains. And that sounds really funny, but it's one of those things where my goal is to begin, to this conversation and any conversation in terms of health is to get the information out there to the community. The community needs to know and what even dementia is and how we can prevent it in our lifetime, and how grandparents and uncles and aunts and moms and dads can begin that conversation of healthy brain aging and just living healthier lives. So.
Well, I think you're going to be a great ambassador for that.
Thank you.
And I hope we can involve other members of the Latino community as well in other areas of California. So, so thank you both for a very interesting and informative discussion. And in the final moment that I have, I would like to invite all of you in the audience to consider volunteering for research at the Stanford Alzheimer's Disease Research Center. We very much need volunteers. We do longitudinal research. We do many different kinds of studies that you might be eligible for and interested in. So the phone number should be on your screen. We welcome your calls. We will return your calls. We will answer your questions. And we hope that we will be able to provide you with a very satisfying experience, knowing that you are helping future generations. So thank you for volunteering, at least for considering it, and I hope we will see you at the Stanford Alzheimer's Disease Research Center.